What makes you more prone or more likely to get gum disease? Let's talk. Hi, my name is Whitney and I'm a registered dental hygienist here to talk about risk factors for gum disease that you should know. So gum disease, also known as periodontal disease, is a common condition, but please know that common does not equal normal. Unfortunately, more and more people are getting diagnosed with gum disease, but just like heart disease, although it may be common, a lot of people have it, that does not mean it's normal nor good. So what gum disease does is it affects the tissues surrounding the teeth in a negative way. It can lead to bone loss and tooth loss, affecting your ability to eat, talk, smile, overall affecting your quality of life. Now, there are many factors that can contribute to why some people are more prone to gum disease than others, and the root causes often involve a combination of genetic, behavioral, and environmental factors. So let's talk about the top 8 risk factors for gum disease, starting with number 1, poor oral hygiene. Plaque, a sticky film of bacteria that forms on teeth, is the primary cause of gum disease. People who do not practice good oral hygiene habits, such as regular brushing, flossing, and dental checkups, visiting their dental office routinely for routine cleanings, are at a higher risk of developing gingivitis, which leads to gum disease. I'll link my video that explains the differences between gingivitis and periodontitis, but for the purpose of this video, let's move on to number 2, smoking and tobacco use. Smoking and using tobacco products significantly increase the risk of gum disease. These substances impair the immune system and make it harder for the body to fight off infection, including those that cause gum disease. These substances impair the immune system and make it harder for the body to fight off infections, including those that cause gum disease. And a not so fun fact, when we check for gum disease during your routine dental appointments, we rely on a visual exam, x-rays, and perio charting to measure the health of your gums. Since smoking constricts blood vessels in the gums, they may not bleed even when gum disease is present. So smoking and tobacco use can actually hide the signs of gum disease. This makes it even more critical to track those probing numbers, since a quick visual exam may miss the signs of gum disease. So basically, if your gums appear to look healthy and you smoke, it could be an illusion. And next, with number 3, genetic predisposition. First, an important clarification: while genetics can play a role, it's essential not to get discouraged or assume it's the only factor. Often, dental providers will hesitate to talk about the genetic risk because patients sometimes think there's nothing they can do, and we don't want to discourage you, because oral hygiene, the first one we talked about, is still a significant factor in preventing gum disease, whether or not you are genetically predisposed. Yes, some people need to work harder than others with consistent brushing, flossing, and regular dental visits, but please know, although genetics might increase your risk, good oral care can help keep your gums healthy and maintained. These genetic factors may make you more susceptible to the bacteria that cause gum disease and affect how your body responds to the infection, but please remember, this doesn't mean you are doomed forever. It just means you might need to pay closer attention to your dental health. Number 4, certain medical conditions can also increase the risk of gum disease, such as diabetes, for example. Diabetes affects the body's ability to regulate blood sugar levels, which can impair the immune system's response to infection, including gum disease. Again, doesn't mean you're doomed, just means you might need to work harder than others. Number 5, hormonal changes, such as those that occur during puberty, pregnancy, menstruation, and menopause, can make gums more sensitive and prone to gingivitis, which can lead to gum disease. I will link my pregnancy and menopause videos if you want to learn more. Number 6, poor nutrition. This one is huge, and I probably should have put this one up higher on the list. But yeah, a diet lacking in essential nutrients can weaken the immune system and make it harder for the body to fight off infections, including gum disease. I will also link my healthy foods for teeth and gums video if you'd like to learn more, but please know, healthy food for your body usually overall correlates with it being healthy for your mouth as well. Number 7, certain medications. Similar to medical conditions, some medications themselves, such as antihypertensive drugs, antihistamines, and antidepressants, can reduce saliva flow, which plays a protective role in oral health. Reduced saliva flow can make it easier for bacteria to thrive in the mouth, so anything that may cause dry mouth can technically increase your risk of gum disease as well as cavities. I'll of course link those videos of mine below as well. And lastly, number 8, stress. What doesn't stress do to us, right? I feel like stress is the root cause for every single thing there is out there. It definitely seems like it, but regarding dental health, chronic stress can weaken the immune system again, making it easier for infections to take hold, including those in the gums, as well as increase your risk of clenching and grinding your teeth, which in turn can increase your risk of gum recession, which can worsen gum disease. This is because the habit of clenching and grinding your teeth puts excessive force on the supporting tissues of the teeth. The teeth are banging together, damaging the tissue foundation that holds them in. This can, of course, speed up the progression of gum disease. So overall, inflammation, we all know inflammation, puffiness, it's the response to infection, injury, or irritation in the body. And in the case of gum disease, the body's immune system responds to the presence of bacteria in the plaque and tartar by causing inflammation in an attempt to eliminate the infection. However, puffiness, inflammation, unfortunately cannot remove the plaque and tartar. The only things that can are brushing, flossing, and getting routine cleanings at your dental office. If you don't do that stuff, if the bacteria persist due to poor oral hygiene or other risk factors, this now chronic inflammation can occur, leading to damage to the gums and other supporting structures of your teeth. So, to reduce your risk of gum disease, whether or not you're prone to it, you gotta keep getting routine dental cleanings at your dental office, as well as brushing 2 times each day, flossing and or cleaning between your teeth at least once each day. Possibly more if you're prone to gum disease, right? And always make sure you're using the proper technique. So many people are brushing and flossing, but they're doing it wrong. So to make sure you're doing it right, I will link my free oral care guide in the description box below, where you can find all of my home care demo videos, tutorials, nutritional information, and more. So be sure to check it out if you want to amp up your home care game and learn how to do everything you can to prevent both gum disease and cavities. And for even more toothy tips, visit my website, teethtalkgirl.com. I hope this video helped you. Until next time, I'll see you all on Instagram at teethtalkgirl. Peace, love, and teeth.